All right, go for it.
All right, welcome everyone. Thanks for joining today, and thanks for joining via actual video. It's so fun to be able to see people's faces since we are in this very different time. For those of you who do not know who I am, my name is Ashley Danielson. I work with Advantage Dental, and I am an expanded practice dental hygienist. I have been providing dental services to Head Start in Hood River and Wasco County since 2015. Last year, you guys probably remember seeing my coworker, Jessica. Our program's footprint has really expanded in the last couple of years, which has pulled me in a couple of different directions. So she was helping me out with Head Start and providing the services to your guys' kids. But due to the lack of number of kids in school this year, you guys will have me back this year. So I'm really excited to be able to see a lot of you in person. And I do recognize a lot of faces, so it's great to, see everyone again. So today what we are going to go over may be a familiar PowerPoint to some of you. I think we have gone over this in the past, but I have added some new slides this year. So that way you guys can have hopefully some answers to some dental related questions during this pandemic. So we're going to be going over the PowerPoint. It's called First Tooth. It's hopefully going to give you guys a lot of information on how to communicate with families about the importance of dental care. I know that you guys aren't seeing a lot of kids in person right now, but even over video, some of this might be helpful, especially if you guys know some questions to ask parents and that kind of thing. And, I guess if they're using their phone, they might even be able to, have their kid get up close and personal with their teeth and that kind of thing if the child feels like they're experiencing a problem. So Ellie, I'll have you go to the next slide, please. Perfect. So one of the main reasons why it's really important for kids to go to the dentist at such a young age is really just to, help establish that relationship with the dentist. And we always need to be mindful that if kids are not going to the dentist, cavities, can lead to pain, fevers, infection, the kids having not the ideal bite, how their teeth bite together, and that can affect things later on when they get their adult teeth. The inability to concentrate is a big one. So kids do not feel pain the way that adults do. And a lot of times when I see a tooth that is very obvious that it would probably hurt, a lot of times the child tells me that they're not having any pain or anything like that. But if we, really pay attention to some of the other aspects of the child's day-to-day, we might notice that they're, not paying attention all the time. They have a hard time focusing. They're maybe a little bit more irritable than they would normally be. And a lot of times that's because they do have a tooth that's hurting them really, really bad, but they just really don't know how to communicate that. Early childhood cavities can also lead to impaired language development, and it puts them at a much higher risk of developing cavities in their adult teeth. Next slide. So in our world today, it's always very respectful to be mindful of cultural diversity. And so I know that you guys probably get trainings on that. But mainly one of the things that I always like to remember around this is a lot of times their diet. And so a lot of families, especially families in the Hispanic households, will have a little bit more intake of rice and tortillas, which are very much cavity causing foods that we'll get to a little bit later. So we do not want to encourage them to not eat those things. Those things are part of their culture. It's part of their life, but we just want to explain to them how those foods do play a role in the cavity causing process, and to encourage them to make sure that they are helping their children brush their teeth twice a day. So next slide, please. So this slide and then the next couple ones will be really, really good ones for you guys to keep somewhere that you might be able to reference back so you can look at some pictures. So this one talks about defining early childhood cavities. So I'm trying to see really quick because I can't see this picture completely, but that's okay. So this is the process of demineralized areas of the teeth. It's really also important to remember that even if a child has like what we call these warning signs of cavities, that these things can progress and spread pretty quickly. And a lot of times they happen on teeth that have the least amount of saliva. So saliva does play an important role because it kind of, helps things get washed off of the teeth. And so a lot of times this is often associated with having a bottle or a sippy cup throughout the day or the night. So do you guys have a lot of families that you feel like their kids drink a bottle a little bit longer than they maybe should, or use it in a little bit of a different fashion than just for food intake, if you will? So a lot of parents will use the bottle or the sippy cup, as a soothing mechanism, especially to help their kids get to sleep, which is very understandable. I mean, I have 2 kids and I completely get that sometimes that's just what you need to do, is whatever the easiest thing is. So one of the things that's important for you guys to know is that frequent nursing throughout the night or going to bed with a bottle or a sippy cup can lead to increased cavity risk on kids. There are a lot of times that you're not going to be able to change the mind of the parent, and you are definitely not going to be able to get them to change their habits, because that's just what's easy and it's just what happens. And so in those circumstances, what is best for you guys is to, have the knowledge behind you that those habits do increase a child's risk of getting cavities. So, explaining to the parent that their kid is at a higher risk of getting cavities. So talking about brushing the teeth first thing in the morning, making sure that they're going to their regular dentist appointments, making sure that they're participating in the dental services that I offer at Head Start. So all of those things together, we can all work together to help these kids stay healthy and cavity free. We'll go to the next slide, please. Next slide. Perfect. So these are the first signs of cavities. So what you can see right up there by the gums are some white lines. So plaque that lives on teeth is what you could scratch, if you scratched your tooth with your fingernail and saw a little bit of white on your fingernail, that's called plaque. We all get it. And that is one of the main things that contributes to cavities on the teeth. So when plaque is not brushed off, it will leave white scars, if you will, on the tooth. So that's what you can see here on this slide right up at the gum line. So these white areas will often appear right at the gums, and they will look kind of chalky. So if, a parent is, wondering or something, you can say, well, it'll be right at the gums. It'll kind of look a little bit chalky. It won't usually look glossy like the rest of the tooth. And that is the first sign of a cavity. It's also important to not freak the parent out, because those white marks are not actual cavities. They're just what I like to call warning signs. So if we do start brushing the teeth a little bit better, making sure that we're using fluoride toothpaste if the family is open to that, making sure that the child is going to regular dental appointments, we can keep those areas strong, and hopefully a cavity won't ever develop. So if the child is not having those things done, more likely than not, those chalky white lines will turn into an actual hole in the tooth, which is a cavity. So we can go to the next slide. So those chalky white lines are called demineralized areas, areas that have lost minerals, demineralized. So not to be confused with fluorosis. So fluorosis is when we have gotten a little bit too much fluoride that we have swallowed, usually by the mode of water, fluoride in the water, and also consuming a lot of fluoride through eating toothpaste or drinking Act mouth rinse or something like that. I see a lot of fluorosis actually on kids and adults who have lived in Mexico or certain parts of Spain and Europe, those areas. So Europe, not as much anymore, but we see a lot of, families that are from Mexico or that grew up there when they were little. So fluoride is a naturally occurring mineral that exists in our soil. So some areas of the world have more fluoride dense soil than other places. And so certain areas of Mexico don't have a filtered water system. They just have wells that provide their water to them. And a lot of those areas, are high in fluoride concentration. So, obviously as the people drink water, they're getting a lot of fluoride that they're swallowing, and that can show up on our teeth. It actually, in a lot of times means that their teeth are really, really strong. And a lot of those people do not have problems with cavities. So a lot of the families that I meet through WIC primarily, I will do a dental screening on the mom at some point, if she's pregnant or if she just has a general concern or something like that. And I will oftentimes notice the fluorosis, and I'll talk to her about that, and I'll ask her, where did she, a lot of times it was, somewhere in Mexico. And so then that gets brought up, and she's always like, oh, well, I've had so many people say, oh my gosh, I was so, curious, what that was. I always thought, because you can see the severe case here of fluorosis, those areas on the teeth almost kind of look a little bit brown. So people think that there's something wrong with their teeth, or, that they're cosmetically displeasing. And I just really try to say, you probably have the strongest teeth out of anybody that you know, because that fluoride really does make the teeth strong. But overall, the difference between fluorosis and demineralization is that the fluorosis will show up lower on the teeth, down by the edge of the tooth, not by the gums. So that's how you would distinguish a difference in demineralization or fluorosis. So we'll go to the next slide, please. So this is what we would categorize as severe cavities. So if a parent is able to look in their child's mouth, and if they see holes in their child's teeth, if a cavity is big enough to see with your eyes, it's usually pretty big. So if any of you have ever had a cavity, which I have had lots, so I'm sure that you guys more likely than not have had one. But a lot of times the dentist will find the cavities and they show up on an x-ray, and they're little enough to be able to see with an x-ray, but not to see with your eyes. And so that is ideal in the sense that that cavity hasn't had the opportunity to attack the majority of the tooth, if you will. So the dentist is able to fix that cavity while it's small, and then hopefully we can provide the family with the information and the help that they need from that point on to keep the rest of their teeth healthy. So if a parent can see a hole with their eyes, that cavity is pretty darn big, and that child needs to go to the dentist sooner than later. The bottom left picture says abscess. That is the sign of an infection, and that will look like a bubble on the gums that is right above the tooth. It is usually accompanied with a pretty icky taste, and the bubble will come and go. And so, sometimes a child will say like, oh yeah, it usually goes down, and then, it's not there for a while, but then it comes back. And so that's really normal. And if a child has an abscess, or what we just like to tell parents as an infection, that is definitely something that they need to let the dentist office know when they call them. because they will be able to, you know, hopefully have an appointment that happens sooner rather than later. So we get to the point where we're looking at kids sometimes that it's like the picture on the upper right, where the teeth are so far decayed that there's really not hardly any tooth left. And so not often, those kids are sometimes not even in pain because the cavity process is so far along that the whole nerve of the tooth is dead. But what that's doing is that's a lot of bad bacteria. So anytime you have a cavity that's not fixed, that's extra bad germs that are living in your mouth. So as that kid naturally loses their teeth and gets adult teeth, you have to think about, we want these adult teeth to grow into the healthiest environment possible. So if all of those top teeth are kind of rotten right down to the gum line, and this child is going into kindergarten and they're losing their two bottom teeth, and those teeth are growing into a mouth that has, you know, 4 to 6 rotten teeth, that's not a very healthy environment for those teeth. So that's one of the things that is helpful for you guys to kind of have in your back pocket and to be able to explain to parents. So many times, more often than not, I have families say to me, I'm not wasting my time taking my kid to the dentist. It's so many appointments. The appointments are so long. I have other kids. I don't have anywhere to put them while I take them to the appointment, and they're just baby teeth and they're just going to fall out. So it's not that big of a deal. So it is a big deal, especially if we go back to slide number 1, where we very first started. The things that cavities can do to a kid, speech development, you know, those things are really important. Just in general, their ability to focus, making sure that they're comfortable. And then again, making sure that their adult teeth have a healthy environment to grow into. So those things are what I would consider talking points if you do have a family that is resistant to going to the dentist, just because they believe that those baby teeth are going to fall out and they're not really that big of a deal. So next slide, please. All right, so Ellie, click 3 more times. Keep going. Okay, 1 more. Okay, right there, perfect. So this is what we like to call the caries process. So remember that caries is the fancy word for cavity. So this is the cavity process. So you have a healthy tooth.
Actually, before you keep going, we had a request to go back to slide 1 that you were referencing. So they can, hold on, so they can relook at what those risks were from the beginning.
Sorry, I'm not looking at the chat box.
I'm monitoring it.
Okay, good. You monitor that and you just interrupt me, because that's perfect. I want you guys to, if there's a question that you have or something, type in the chat box for Ellie to stop me, or unmute yourself and feel free to stop me, because I want this to be, even though we're Zooming and it's not like our ideal situation, I want it to be as involved as we can. So low-grade fever goes along with the infection. So if a child has a really, really decayed tooth, they're going to probably have an infection at some point, because that's what happens when the nerve is exposed. So when the cavity eats away enough of the tooth structure for the nerve to be exposed, the bacteria gets into the nerve and it causes an infection. The infection is going to prompt the low-grade fever. So pain, infection, low-grade fever. So the crooked bite isn't really necessarily the best language for that bullet. So a lot of times what will happen is if teeth get decayed and then they're decayed down to the gum line, if a tooth doesn't have a buddy right next to it, and if this tooth is gone, this tooth right here will naturally start to lean. It happens to adults, it happens to kids. So if these baby teeth are like missing intermittently here and there, their other teeth that they have are gonna start to lean. And then as their adult teeth are getting ready to come in, those adult teeth don't have the appropriate space to come into the mouth. So one of the other ways to think about baby teeth is they are space holders for the adult teeth. So that's kind of what the crooked bite means, is that if teeth are missing throughout the mouth, the existing teeth will lean, and then the adult teeth won't have the appropriate space to grow into. Extensive and costly dental treatment. So if parents continue to put off and put off and put off and put off, raise your hand if you've ever worked with a family whose child had to be sedated or maybe taken to the hospital to get their dental work done. I know too many to count, all of you. So there's nothing that we can do about those kids. We need to just be happy that they received their dental treatment, no matter how extensive it was, because that's great, especially if they're sedated. That means that they more likely than not didn't have a bad experience necessarily, so that's really good. But what that can provide you guys as advocates for these kids, and then just people that interact with families on a regular basis, the knowledge and kind of the background as you move forward with new families, the conversations that you want to start having when these kids are really, really little. And so that's important. So we talked about the ability to concentrate, language development. So obviously there are lots of kids that have language development and speech issues, and there's nothing wrong with their teeth at all. But it's really important if we're talking about teeth, or if we're talking about, you know, the right spots in our mouth for our tongue to hit when we're saying our specific letters and those kinds of things, we need our teeth there, you know, for that proper language development. So did that answer everybody's questions going back to that first slide? Great, okay, good. Okay, so when we're talking about the cavity process, and there are a couple of other really, really good slides coming up, one of which I will encourage you guys to maybe have Ellie print for you and provide, because it's a really good visual for parents, and it kind of makes things like click, like, oh my gosh, now I get it. So, but we have a healthy tooth. We all have germs in our mouth. So no matter how often you brush your teeth, how often you floss your teeth, these germs live in our saliva. So we all have the same kinds of germs, but some of us have more cavity causing germs than others. Some of us have more plaque causing germs than others. We're all just a little bit different in that sense. So when we feed those germs, they produce an acid, and it is the acid in our mouth that causes cavities on our teeth. So you heard me talk about plaque a little while ago. So if we have a lot of extra plaque on our teeth that our toothbrush isn't getting off, that is just like an extra sticky place for germs to live, where they're actually hooked onto your tooth, because that plaque is kind of, you know, adhered to your tooth a little bit. I mean, it's slimy and it's sticky, so it can be removed. But it's not going to just go away if you drink water. So the acid is the important thing to remember. So it's good to know, just for our own selves, but also when communicating with our families, that it is not sugar that causes cavities, it's acid. And so the bacteria eat what we eat, and they produce acid. So certain foods like carbohydrates, so bread, pasta, cereal, granola bars, tortillas, rice, chips, crackers, those kinds of things have, if you looked at it from a more scientific level, they have complex carbohydrates, which mean they have a complex sugar molecule attached to them. So those foods will produce more acid than meat, cheese, yogurt, even fruits that are sweet. They don't have that carbohydrate component. So even though they are sweet, their sugar molecule is a little bit smaller and looks a little bit different than the sugar molecules in bread. And so, so fruit is really okay. I mean, I would rather have kids eating fruit than eating granola bars. Obviously, things that are sticky, like fruit snacks and those kinds of things. So the other important thing to remember is that we are not going to be able to have kids stop eating those things. That's life. That is what kids like. That is what families eat. That's what is provided in school lunches and that kind of thing. So the most important message to get across is the fact that the germs eat what we eat. These specific food groups will cause more acid in the mouth. And we have to remember that the acid causes cavities. So that's why it's really important to make sure that you're brushing your teeth before you go to bed, because you don't want a mouthful of acid, if you will, when you go to sleep and you're sleeping all night long, because then it just, you know, is sitting on the teeth and it's able to attack the teeth and that kind of thing. That's also another really important reason to push for water in between meals. If a child is going to drink juice, or if they like pop or whatever it is, it's okay to drink those things when you're eating a meal, because let's just say you're going to Subway. So you're getting a Subway sandwich, you're getting a bag of chips, you're getting a cookie, and you're getting a Pepsi. So even without the Pepsi, the acid level in your mouth is going to drastically increase because you ate bread, you ate chips, and you ate a cookie. If you throw in a Pepsi, it's not really going to increase the acid in your mouth that much more, if you will. But if you ate all those things and then got a giant Pepsi and then just continued to sip on it between like lunch and dinner, that acid level in your mouth is going to stay at a high level. It's never going to have the ability to go back down to what we call a neutral or a baseline level. So that's why it's really important to drink the non-water drinks with a meal and drink water in between meals, because it will kind of neutralize and bring that acid back down to a baseline level. So we'll go to the next slide. All right, so this is the slide that I love to print out for families. This is something that I have laminated and I have with me all the time. So this talks about acid levels and when you're eating. So anytime you see that hump and you see that orange, that's when the acid in your mouth has increased. So if you think about having, and very rarely do people really just eat 3 meals a day. You know, a lot of people will have a snack in between and that type of thing, or a drink that's not water in between. But in our ideal world, we would have breakfast, lunch, and dinner. And let's just say, hypothetically speaking, the breakfast was pancakes, the lunch was a sandwich and chips, and then the dinner was spaghetti, or the dinner was tacos, or whatever. So all 3 of those meals include foods that would increase the acidity in the mouth. So we really want to make sure that in between those meals, that acidity is coming back down to that, I don't know if that's yellow or cream or whatever is below the blue. So that's what we kind of consider our baseline. So for a snack, if we can eat something that would be considered more of a whole food, you know, meat and cheese, or fruit, or some type of a vegetable, or nuts, or yogurt. Those are foods that are not going to increase the acid levels in our mouth as much, if at all. And so those are the great snacks to have in between. So that way we're not looking like the graph that's at the bottom. So all of those waves that you see, all of those humps, are where the acid has increased in the mouth during the day. Maybe these kids or these people are eating snacks that are chips or granola bars, or they are drinking drinks that are not water in between meals. And so if you look at that, the acid level in the mouth was higher throughout the day than it was at a baseline level. So again, we're not trying to change what people do or how they eat necessarily. We're just trying to provide them with the facts about what they are eating and what they are drinking, and how that's changing the environment of their mouth and how that environment is affecting their teeth. So we will go to the next slide. So this is just a really easy, simple go-to that talks about healthy snacks and cavity-causing snacks. So obviously, like the cavity-causing snacks like Gatorade, people think that, you know, that if they've been playing soccer or, you know, they're doing some type of a summer league thing, or they've been at the swimming pool swimming, that they need that something that's going to like replace their electrolytes. But you really need to sweat a lot and that type of thing to really need that like electrolyte replacement. I don't think it's bad to have Gatorade. I mean, I drink that kind of stuff and I do give it to my kids once in a while. But it's just important to remind parents again, you know, if you're going to have this, just know, and, you know, definitely make sure that you brush your kids' teeth that night. So we always have to remember also, in the big picture of things, it takes a long time for a cavity to form. It takes a while for a cavity to go from that demineralized area, that chalky white line by the gums, to an actual hole in the tooth. So if we're able to kind of have these motivational talks with our families from the very, very get-go, hopefully when the kids have healthy teeth, or when the kids are babies and, you know, they are nursing or drinking bottles frequently because they're 3 months old and they don't have teeth yet. It's just important to kind of have all of this, you know, background information so you can help prepare the family for kind of what they have coming up in the future. And, you know, telling them, you know, if you keep your kids' teeth healthy and they don't have any of those warning signs of cavities, like, it is definitely okay for them to have candy every night after they eat their dinner, because sometimes you have to bribe them with something to make them eat their dinner. Like, that's life sometimes. And it's okay to eat candy, and it's okay to have ice cream, and it's okay to have that stuff, as long as you are brushing your teeth well and doing your part if you're going to have those things. So we will go to the next slide. All right. So this is just something that I always like to include because I feel like it's just interesting and it provides you guys with a little bit of information. How many of you think or have heard people say, my teeth are terrible because my mom's teeth were terrible and it's genetic? So that is, so that is super, super common. It is not genetic in the sense that you do not get bad teeth or good teeth based on what your mom had, and that's what she gave you when she was growing you in her stomach. So bacteria is something that is given to a child between the age of 0 and 2. So if I would have given my kids up for adoption and adopted them out to 2 different families, we'll just use this as an example because I feel like it's the most realistic example to think of sometimes. And the first family that my child went to was a stay-at-home mom, and she had really good teeth, has only ever had 1 cavity in her life, but she hasn't had a cavity in like 10 years. And she's the primary caregiver and she's a stay-at-home mom. And then, so more likely than not, that child that was my biological child is going to more likely than not get bacteria through saliva transmission from that adoptive mom. So saliva transmission can happen from drinking off of the same cup, same straw, eating off of the same utensil, or kissing a child, which we all do those things, and it's almost impossible not to do those things. And then if I had baby number 2 and I adopted that baby out to a different family, and the mom was a nurse, so she worked the majority of the time, but the dad was the one who was, you know, there for, you know, the morning time, and then maybe the child went to daycare or something, but then came home. But because the mom worked a 12-hour shift, you know, the dad was the one to cook dinner and, you know, do all of that. And the dad had a history of lots of cavities, gum disease, really bad teeth. that adoptive kid is more likely than not going to get that kind of bacteria, because that individual is who the child has the most contact with. So that's usually what it comes down to. So it is not something that you give your kid in utero. It is 100% based off of saliva transmission between age 0 and 2. And then once you are 2, you have the type of bacteria that you're going to have. So you may have a lot of cavity causing bacteria, or you might not. And so it's not super popular, but there are like bacteria tests you can get. It's usually like a swab that you do in your mouth, but it would like tell you the different levels. People usually don't do them because it's kind of like, I don't know, I guess some people just like to know that stuff, but it's not super important. So, so if the mom has a history of a lot of cavities and she's still getting cavities and going to the dentist, it's important to encourage her to try not to share a utensil with her child if possible. There are some times where it's not. To remind her to kiss her baby on the cheeks and on the forehead, not directly on the mouth, which again, she's going to do what she's going to do, but there are a lot of people who know the struggles that they have gone through having all of those cavities. And if they could prevent their kids from having that same exact thing, they might appreciate knowing some of those things. So sometimes it can help you out in a conversation, or it's just, you know, good for you to know. So we'll go to the next slide. All right, so let's see. I can't read all of these slides because all of the pictures are in the way. Oh, hang on, let me move you guys. Oh, here we go. Okay, so giving a baby a head start to a healthy mouth. So the mother is often the family member who establishes good eating and brushing habits for the entire family. So sometimes I wish that I would change this word from being the mother to sometimes a sibling. So it's like, I feel like this is a good slide to, or this is a good bullet to remember for families. But it's oftentimes, you know, sometimes it's the older sibling, a lot of times it's the mom, but sometimes it's the dad. But it's really important to kind of have that lead person in the house, like who puts the kids in the bathtub, who puts their pajamas on. So sometimes asking some of those questions might help to kind of establish who that family member is in the house that might be able to best help with the brushing habits. And then also encouraging that person, whoever it may be, to be a good model for brushing habits and eating habits. And then it is definitely safe and, oh, primary caregiver would be the best. Thank you. That I should change that. I will make a note. So I like that. It is great to start brushing your baby's teeth as soon as the first tooth pops in. It's also definitely okay to brush. Let's see. How do I get everyone's pictures back? Hang on just a second. Oh, here. Okay. Sorry. Can you guys see me still? Oh, here we go. Sorry, I'm messing around with this because I'm trying to find everyone's picture. I felt like I was like lost in some world. And it's definitely okay to encourage parents to brush the kids' gums. So especially if they have a little baby toothbrush, which oftentimes we have supplied you guys with in the past, or even just using a washcloth. I know that my daughter had thrush when she was little, and so it was important for me to use a washcloth or something to kind of like rub on her gums and get any kind of film removed. So we can go to the next slide, Ellie. This table doesn't always make sense to me. It does because I know some of these weird numbers, but this is just the amount of fluoride that is okay for a child to have at different ages. So if you guys do have families that live, I rubbed my baby's gums with a clean finger before their teeth came in. Yes, that's perfect. That is so great. So if your guys' families live in the Dalles, and if they live on the east side of Chenoweth School, they have fluoride in their water. And if they live on the west side of Chenoweth, they have a different water district over there, and they don't have fluoride in the water over there. So your 10th Street kids would have fluoride in their water there because you're not on the other side of Chenoweth. And the Petersburg kids, I don't know if Petersburg though is on the Dalles water system or if that school is off of a well, but the main city of the Dalles does have fluoride added to their water. Hood River does not have fluoride added to their water. When they do add fluoride to a water system, they do definitely keep in mind that kids are going to be using fluoride toothpaste, and they do take into consideration that they're going to be swallowing that, and they're maybe even going to be swallowing fluoride mouth rinse. And so the amount of fluoride that's added to water is really, really low to, kind of accommodate for other modes of fluoride, supplementation, such as, even like the drops that you can get from your dentist. Swallowing fluoride is what we call systemic fluoride. I like to think of that as getting fluoride into your system. Topical fluoride is getting fluoride put on top of something. So topical fluoride is like what I do to kids at Head Start. I'm putting fluoride on top of their teeth. It is usually either sticky or liquid, and we're covering it up with sticky fluoride. So there are not any traceable amounts of fluoride able to be seen on a systemic level because it's designed to kind of like just stay on their teeth, even though, they're kind of swallowing it, but there's not enough in there for it to even like show up if you were to do a blood test. So those two different modes of fluoride are really, really important to understand and to know. Systemic fluoride, so the fluoride that we swallow, is very, very similar to taking a prenatal vitamin while we're pregnant. We take that prenatal vitamin, even if we are a completely healthy female, we take the prenatal vitamin to give our growing baby the vitamins and minerals that they need to be the healthiest baby that they can be. And I'm sure that babies that their parents did not take their multivitamin or whatever are still probably pretty healthy. But if we know from research-based studies that have been done and conducted for years, and the states that have fluoride in their water system all throughout the state versus not, the kids who have had systemic fluoride that they swallow from 6 months on have a significantly lower rate of cavities than kids who did not receive fluoride. So there's all kinds of crazy things that you can read and that you may believe. It's not my goal to change anybody's mind on fluoride. If you have very specific opinions on fluoride, that is absolutely okay with me. Everyone has different views on all kinds of things, but it's just like sunscreen. I mean, there are a million bad things in sunscreen that obviously have like caused places like Australia to ban certain types of sunscreen because it's killing the coral reef, which is technically a living thing. But it's like we're putting that on our skin and it's baking into our skin, and what is that doing to our bodies? But we do it because if we didn't, we could get a sunburn, and the sunburn would result in possible skin cancer, so there are just all of these things. So I really don't like families to obviously Google things or whatever. It's like if they do, I just, try to encourage them to look for, research-based articles and not just like the first thing that you read, because like people will say that fluoride is in rat poison, which it probably is in some aspect. I don't know, because I've never really looked at rat poison, but all these different things. So, but that's just a graph that if you guys ever needed hard numbers or something like that, you could refer back to. So we'll go to the next slide, please. All right, this is our consent form. So it's very important for me that you guys kind of know and understand the consent form, but mostly that you understand the difference between me and the dentist. So the best way to think of me is the dentist's sidekick, if you will. So I don't work for Kids Dental Zone. I don't work for Little Shredders. So I like to consider myself the sidekick to all dentists, no matter who that is, because in a very, very realistic world, a child is usually only going to the dentist a few times a year. And hopefully that is for their regular cleanings and checkups, which that would be 2. And then any other dental appointments that they needed within that year to fix any problems that they have. So what we've learned over all of the years is that kids really don't learn a lot from the dentist. So even though the dentist might be super, super nice and might give you some, little tips, we really have found that it's the work of the dentist, it's the work of educated family members, it's the work of people like you, and it's the work of people like me who are present in school-based settings to provide that additional fluoride treatment, to provide that additional hands-on brushing demonstration, and just to provide that additional information to, we all have to work together as a team to keep these kids as healthy as we can. It's not just one person's job. So when parents get this form, they might say to you, well, my kid already goes to the dentist and we go every 6 months, so we don't need this free service. A lot of times families see free as a handout, and if they already have their medical and dental things kind of handled and under control, they don't think that they need this service. But the best thing to say to families is, oh, okay, great. Your child has been going to the dentist every 6 months since she was 1. That's perfect. We want you guys to keep doing that. Ashley is not a dentist. She is a hygienist, and her job is on-site dental education, as well as providing preventative services. So she does not treat all kids the same. She checks their teeth by just doing a visual screening. She uses a little mirror and a flashlight to look at the kids' teeth. And then based on what she sees, she might provide a fluoride treatment to the kids if it looks like they have had fillings in the past. Because if they've had fillings, that means they've had cavities, and we want to keep all of their other healthy teeth as healthy as possible. Or, maybe you guys haven't made it back to the dentist yet for their fillings. So she could put some fluoride on, those teeth that still need fillings to, help control the bad bacteria, so those cavities don't grow and get a lot bigger. And if you do mark yes, so I'm still pretending that I'm talking to the parent. And just so you know, mom, if you do mark yes to all of these services, that does not mean that she's going to do all of those things to your child. She's going to start with the first thing on the list, which is the screening. She's going to look at the child, and then she's going to provide any of the below services on an as needed basis. And you will get what we call a report card that just tells you what she saw on your child's teeth and what preventative service she applied. That will get sent home with your child right after that day of the screening. So you will be kept in the loop, so you know. So I feel like those are some of the biggest questions that I get. I do a lot of in-person registrations, like primarily for the Dallas Middle School. Historically, they have always had their families register in person. And those are the most frequent questions that I have got. Or like, does my kid really need all of these things? How do you know that my kid needs all of these things? And I say, oh, I don't, but it just gives me permission to do them if I need to. And they are all things that just help keep teeth healthy. And so if I can help be the sidekick to the dentist and help keep these kids healthy, that should be all of our goals. So
Ashley, I would just like to sorry,
Oh, yeah,
Ashley,
go ahead.
I'm going to interrupt for just a second. I just wanted to point out that Ashley just goes to our Oregon sites. We actually have Dr. House from Kids Dental Zone go to our Washington sites. And he does the same things. I'm not sure if he has the silver fluoride with him, but I do
He
believe
does.
he does. Okay, so yeah, he brings all that same stuff, does the same thing for our Washington sites. It's just a different person.
And the only reason, in case any of you are wondering, I am not licensed in the state of Washington. With what my family does, what my husband does, we would never move there. And the Washington Board of Dentistry has a lot of different requirements for hygienists in that state. And so it's really not feasible for me to acquire a license over there. But yeah, like Ellie said, the great thing is that it is Dr. House, and Dr. House for a very, very long time was the board chair of Advantage Dental. And he is probably one of the main people behind the services that I provide and creating the process and protocol that I have to follow. So he doesn't have as much of a presence with Advantage Dental any longer. He used to a long time ago, but as he is getting a little bit closer to retirement, he's kind of started to fade out of some things, and that was one of them. So, but nope, he's a great colleague, and I lean on him for a lot of questions that I have. So we'll go to the next slide.
And Ashley, I don't know if this is in a later slide or not, but a lot of parents, I think, have a little more of a fear towards silver fluoride specifically. So
Yeah.
I don't know if that's something that you're going to address later, or if that's a question that I can ask now.
Nope, that's a good question to ask now. I did not have that. So silver fluoride is a liquid type of fluoride that does contain some liquid silver. Its job is to arrest or stop the progression of a cavity. So anytime a child has had silver fluoride applied to a cavity, it will turn that cavity black. So Ellie, can you go back to the slide that says severe caries? Okay. So when I look at those cavities, the best color that I can describe them as is brown. Would you guys agree with that? Okay, so how I describe it to parents is, okay, your kid already has a brown hole in their tooth, and our goal is to get that tooth fixed with a filling, and I can't tell them, you know, I'm sure all of you guys have seen the silver caps on the teeth. Excuse me. So when a cavity gets big enough, if the cavity encompasses more than about 50% of the tooth, that tooth can't hold a filling, because then the tooth would be mostly filling and not as much tooth structure. And that would make the existing tooth structure very, very brittle and fragile, and more likely than not, just like the normal biting against the adjacent teeth would cause the rest of that tooth to break. So if the cavity is large and either touches the nerve or encompasses about more than 50% of the tooth, the dentist will opt to put a silver crown on the tooth. So all little kid crowns, for the most part, except for some of the front ones, they do make the front ones like a porcelain front. So they do look like a white front, but they don't make those kinds of crowns for little kids for the back teeth, because in the big scheme of things, they are going to lose that tooth. And so silver is just what we get. And so what I tell parents is I like to put a spin on this black color that it turns the cavity. So I want to put silver fluoride on your child's cavities. What that's going to do is it's going to make that tooth, A, not as sensitive. It's B, going to stop that cavity from growing and getting any bigger. Anytime anybody has a cavity, an elderly person, any of you guys, me or a kid, if that cavity has not received some type of treatment, it's going to continue to grow. Silver fluoride is considered a dental treatment, and some kids can completely just roll with getting regular silver fluoride applications, and they never have to have a filling. When you have a filling, you have to have a shot. There's usually a drill involved, and on a 4-year-old kid, that's not always super successful. So the other third thing that is the positive thing is I will say, okay, this cavity's already brown. I'm gonna put this liquid on it. It's going to turn it a darker color. If you notice this color change, that's a good thing, because it means that the fluoride medicine is working. It means that all of that bad bacteria in that cavity is dying. And it's also not going to change the color of any healthy tooth structure. So it's like my front teeth, for example, have no cavities on them. If I rubbed silver fluoride all over my front teeth, you would not notice anything, because it only attacks and hangs onto decayed surfaces or really weak surfaces. If you put silver fluoride on demineralized areas, like those chalky white lines that we saw towards the beginning of the PowerPoint, it would turn those areas kind of a gray color. I don't put silver fluoride on those areas because having gray lines at your gum line is very cosmetically displeasing, like 1000%. And so I will usually brush the kids' teeth myself, or I will go down a level in effective like treatment strategies, and I will just apply iodine, which does help to also kill bad bacteria, but it doesn't change anything of color. But I would use that and then fluoride varnish on like front teeth. The other thing that you can tell parents is that if a child has decay in the front and it looks like those teeth have not been treated with so those teeth in the front, especially that lower right-hand picture, in a school setting, when I do not have a parent with me, I don't ever apply silver fluoride to any tooth that has a cavity on it that would be in their smile line, because that is a really good way to piss parents off and to make them not trust me, to make them not trust you guys, and to make them hate the dental person that comes to their school. So a lot of times what I'll do is if a child does have decay in the front and it looks like they have not received any type of treatment, I would usually work with their teacher or whoever the parent. Do you guys call it a parent advocate? What's the word?
They're family health advocates. That's who
family health advocate. Okay,
yeah.
Perfect. So I usually talk to the family health advocate and either A, make sure that the family does get into the dentist sooner than later, or B, work with the family advocate to help educate the family, and then, you know, provide some pictures if necessary, or arrange a time for me to do a home visit, or meet up with a parent at some point so I can apply that silver fluoride to the front teeth. So on a kind of a different note with silver fluoride is after the first application and you notice the dark color, it doesn't matter if you get 10 more applications, even if it's like week after week after week, it's never gonna turn more of a black color. It's always just gonna kind of stay that first initial black color that it originally turned after application number 1. And so it's very obvious. Have you guys noticed any kids with black front teeth? Yeah, okay, I'm seeing Rosie shake her head. Yes, but it's very obvious to me if a child has had silver fluoride on their front teeth. And if the kid is one of Dr. House's patients, I can actually see all of their records and I can see what he's done for them. And so it is important to continue those silver fluoride applications, because it just helps make sure that all of those bad germs in that cavity aren't, you know, it's impossible sometimes to kill them all with just one application. That's why future applications are oftentimes needed, like follow-up applications. So if it's very obvious to me that that kid has had silver fluoride on their front teeth, a lot of times I'll just do it because I know that it's not going to change its appearance. They need silver fluoride appointment. It really, really just depends. So a lot of times what the dentist or what the provider likes to do is apply it once, have them come back within like 2 weeks or something like that. And then they'll usually like feel the decayed area with an explorer, like really lightly. Any tooth structure that has been remineralized. So the goal of the silver fluoride is to kill all of the bad bacteria and remineralize or re-strengthen, if you will, that cavity. So when you feel that with an explorer, that's going to feel hard to an explorer, just like normal tooth structure would feel hard. Any type of cavity that is still like a little bit active, when you touch it with an explorer, it will kind of feel like wet leather. So if the dentist goes in there and kind of feels that, and it kind of feels still a little bit sticky or leathery or something like that, they would probably apply another application of silver fluoride and maybe just continue to check them. I know I work with a lot of different dentists that just have different opinions, I guess, on how many applications that they think is necessary. But I also feel like from my experience, it really, really depends on the size of the cavity. So we can go to the next slide. Did that address all of your questions about silver fluoride? So is silver fluoride good for healthy teeth also? Absolutely. So one of my preventative protocols in my process is if you or the individual that I am seeing does not have any cavities, but you have had fillings within the last 2 years, I will still apply silver fluoride to, I usually just do all of the back teeth. That way I just make sure that if there's any little teeny areas of demineralization on the front teeth, that the silver fluoride isn't touching those areas. Because again, the silver fluoride is going to work to kill the bad bacteria in your mouth that cause cavities. So if you've had cavities within a 2-year window, then that means that there is cavity causing bacteria that lives in your mouth. And so we want to make sure that we get you outside of that 2-year window of being cavity free. And then you would just move to fluoride varnish. And fluoride varnish is what we do now for even all of our kids that present with completely healthy teeth. So the reason why we do fluoride varnish now on all of our kids, obviously they have to have consent for it. But if they have consent and I look at their teeth and they don't have any signs of cavities, they've never had a filling, they don't have any demineralized areas, their teeth just look pretty and textbook and just, you know, the way that they should, I will still apply fluoride varnish to those kids because the fluoride varnish is sticky. It's going to stick to all of the surfaces of the teeth and it's going to help any weak spots be stronger. And to see a very, very beginning weak spot, I can't see that with my naked eye. So I just want to make sure that I am helping to keep those kids as healthy as possible. I'm reading this next question in the chat box. So is silver fluoride good for healthy teeth? Will silver fluoride remineralize the exposed part of the tooth? Yes. So silver fluoride is actually like so good for a lot of things. It's actually a really strong desensitizer. So it's like if you have areas, especially from reseeded gums, that's the dentin that's exposed, the root of your tooth. Those areas can be super, super sensitive to hot or cold. And so silver fluoride really helps with that. But yes, its main job is to also remineralize. So there are some really, really cool slides that were provided from a dental researcher who did a lot of stuff on the East Coast and then also in Alaska. And he has some really cool like cross sections of teeth, and because our teeth are porous and they almost have like these little tunnels and tubes in them. if you were to cut them in half and look at them with a microscope. So any of those little areas that were compromised or a little bit weak, the silver fluoride kind of gets into and penetrates, and it almost looks like sections of rebar in these cross sections of these teeth where the silver fluoride has remineralized and worked to heal, if you will, any weak areas. So it's amazing stuff. It's been used for decades. I don't know if any of you guys are familiar with silver nitrate. Has anyone ever heard of silver nitrate? So no. So silver nitrate is what they put on. If any of you have had a kid, Ellie, have you had a kid yet, or still no kids?
Still no kids.
No kids. Okay, so you know in the hospital right after you have your baby and they get their umbilical cord cut, and then it's like you notice in like the blink of an eye that cord is starting to like shrink up and it turns really dark. Well, it's because they put silver nitrate on it, and silver nitrate's job is to kill bad bacteria. We don't want any bad bacteria getting into that, you know, cut cord because it could not be good for the baby. And so nurses and hospitals use silver nitrate for all different kinds of things. Like if you've ever had a C-section and part of your C-section, like incision or any type of a wound incision, gets like it ruptures a little bit or something happened to your sutures and it gets a little bit infected, they'll put silver nitrate all over that area to attack and kill the bad bacteria to prevent you from getting an infection. So silver fluoride really is silver nitrate, but a little teeny bit different, but with a fluoride component added to it. And the fluoride is part of what helps with the remineralization and desensitizing. So it's really amazing. I think it's just so cool. All right, we'll go to the next slide. All right, this is just a little fact sheet. This is on the back side of all of the consent forms that you will give to your families. I know that people always don't like to read stuff, but this is also a really good little go-to for you guys. So if a family does have a question, you can always kind of reference that. And then I lined out that I provide services on a risk basis, meaning I look at the child's teeth and I do what their teeth need. I don't provide a textbook service to all kids. And I provide screenings, fluoride, like a sticky fluoride varnish coating. Sealants really won't happen to any of your guys' kids. So sealants are only for kids that have adult molars. So usually they don't get their adult molars until they turn 6. So if the parent asks about, like if they inquire about it, you're more than welcome to tell them that. But if they do mark yes to it, I would obviously never do it because none of the Head Start kids have adult teeth. So, so that's just kind of something I just don't really pay attention to. The silver fluoride, what we just talked about, antiseptic for the teeth. I did talk about that just a little bit. That is iodine. So just like if you got a really, I mean, I guess people don't really use it as much anymore, but they use it in the hospital a lot. So if you have a wound that's, you know, really kind of icky and gross and it needs to be cleaned really well, they'll usually use antibacterial soap and warm water and then also clean it with iodine. Also, before you have any surgeries, usually they will wash you with soap and water, and then they will do a good iodine scrub on any area of your skin that they are going to make an incision, because that iodine will also kill bad bacteria. So the iodine is kind of like my second line of defense. It is not as strong and it does not kill nearly as much bacteria as silver fluoride. So if I have consent to use silver fluoride on a kid, that's what I will always use first. But if I don't have consent to use silver fluoride, but I do have consent to use iodine, that's kind of like the next best thing. It's just not quite as effective. And then the protective restorations, that is a fancy word for a temporary filling. So I have like, it's a little bit gooier than the consistency of Play-Doh, but it squirts out of like this little tiny tube, and then it kind of turns into the consistency of Play-Doh, and it's malleable, and then it gets harder. And so if a child does have a cavity, depending on the surfaces of the tooth that cavity is on, if I have consent to do a protective restoration or a temporary filling, I will do that. And so it's really easy. It's literally just like squishing a little bit of Play-Doh into a cavity. But what it does is it prevents food from getting stuck in that hole. And it also protects that cavity from cold temperatures and hot temperatures. And anytime bacteria has access to oxygen, oxygen, you know, allows the bacteria to breathe and thrive. So if we can plug that hole, if you will, and cut off that bacteria's access to oxygen, we have even a better chance of saving that tooth. And so all of the dentists around know what, I mean, any dentist would know what temporary filling material is. It's very, very, very obvious to a dental provider what is an actual filling and what is temporary material. So this child should never go into a dentist office and be confused for this temporary filling being the actual real thing. But then in some situations, I mean, they are meant to last quite a while. So it's like, I've had a lot of conversations with Dr. House, because again, he's the pediatric provider in our communities. And so he's kind of who I lean on. But if a kid is really close to losing that tooth, and because he uses the same temporary filling material in his office, so if either he or I applied this temporary filling to a kid, and then like after you look at their x-rays, you know, you can see their adult tooth coming in, and it's kind of like, oh, they're going to lose this tooth in about 4 months. You know, a dentist, if that child isn't experiencing any pain, rarely ever would the dentist actually take out that temporary filling and put a new one in, because that tooth is going to fall out before the temporary filling falls out. So, so the temporary fillings have proved to be a really, really good service in our community, and really, really helpful. So we'll go to the next slide, please, Ellie. So these are the services, excuse me. These are the services that are very specific to what a dentist provides that I do not provide. I do not take x-rays. I do not provide I do not provide like a conclusive exam. So a true dental exam, you should have x-rays, you know, to help base your treatment plan, or, you know, any type of findings, whether that be cavity free or finding a cavity. I do not provide cleanings. I do not clean kids' teeth. Sometimes if they're really, really icky and gross, I'll brush them with a toothbrush at school. But I know that that's not really allowed right now. I do temporary fillings, but I do not provide permanent fillings, and I do not pull teeth. So those are all of the things that encompass dental services that I do not do. So we'll go to the next slide. So the dentist and COVID. So it's very, I've heard some mixed things in our community just recently, which I thought was really interesting. I have a lady that I know, we sit on a board together, and she actually canceled her dental insurance through the first of the year because she thought that there were no dental offices open. And I was like, where did you even hear that? They were closed for a little while. That's definitely true. They did open back up in April, and they are all pretty much operating as normal as we can. And so your kids and any families that you serve can make a dental appointment at this time. From the offices that I know and have talked to, many offices are only allowing one individual to accompany the patient. Obviously, if the patient is a minor, it needs to be a parent and or guardian. And oftentimes, from just the communication that I've had with a lot of our offices in Hood River and Wasco County, siblings are not allowed. And so that is where we are going to run into some big barriers, which is really, really unfortunate. And I think that you guys would probably have better resources and guidance than myself. But if a family has 4 kids and one kid needs a dental appointment and mom does not have childcare for the other 3, those kids, unless they make a special arrangement with the dentist office, can't go into the dentist office with the mom and the child who has the appointment. So a possible workaround would be trying to schedule all of the kids. I think that they will still allow, that's what I was just gonna say. The possible workaround would be scheduling multiple kids at like, not necessarily one time, but I guess it depends on how many time slots they have available for like the 1 o'clock appointment, for example. But it's like you could schedule, you could schedule one child at 1 and then the next one at 2, or as many at 1 o'clock as you could. That would be the workaround. Or if you told them, you know, my kid, I'm happy to have all of my children be screened, but I don't have any childcare options. I don't know if the office would make a special exception. So I think that that's just going to depend office to office, because there's not one set rule across the board. It's going to be definitely individual. And so that would just be a question that I would encourage the family to ask the office when they do call to schedule the appointment. So we will go to the next slide. All right, so when to brush teeth. I am like laughing at myself because I did not put on here twice a day. So we want to encourage parents to brush their kids' teeth twice a day. So my thinking behind this slide was, I know as a parent, now that I have kids, and my advice used to be a little bit different before I had kids, but now that I like actually know how the day-to-day goes, and that like even if you have a schedule, and I'm a very scheduled person, it's not always realistic. So I have found, for me personally, that brushing my kids' teeth during bath time is very, very effective, and it works very well. So it's like in my house, for example, we take baths right before we go to bed. I know that bath time in all houses is going to exist at a different time. If you read the very, very last thing, it's okay to brush their teeth anytime. So even if you take a bath in the morning, or even if it's every other day, it's better than nothing. So brush their teeth during the bath time. When I had an 18-month-old and an infant, my 18-month-old was still in diapers, and sticking to a super, super strict schedule and like making sure that I brushed her teeth every single morning and every single night, like was not always like realistic. It's not always realistic to like walk into the bathroom and let's brush our teeth. But you know, as a parent, when your child wakes up in the morning, at you're going to change their diaper because they've been asleep all night, and you're probably going to put a new diaper and pajamas on them before you put your child to bed. And so I would always tell parents, you don't just have to have a toothbrush in the bathroom. I have a toothbrush in both of my kids' rooms. I have it in my little diaper changing basket that I have, because you don't always, I mean, we don't want kids to even hardly spit their toothpaste out, because you're not supposed to put very much on. So even if they swallow their toothpaste, that's okay. So brushing teeth during diaper changing time, it gives them something to do and hold on to. Right after dinner, all families eat at a different time. Some families eat, you know, kind of later. So, you know, that could just be something that you incorporate into a routine. If the family is like a reading family and they're like, oh, well, we read every night right before we go to bed. Well, have them brush their teeth and grab their book and, you know, do that. So the whole point of this slide was to help you guys kind of think outside of the box a little bit if you needed any tips on that, and to just let parents know that you don't have to do it in the bathroom at like the designated like appropriate times, being first thing in the morning and right before you go to bed, because that's not always real life. So let's figure out a way to get the parents brushing the kids' teeth, hopefully more, or at least once a day, during a time that works good for the family. So that's something that's also going to be very individual, but these might be some good tips for you guys. So next slide, please. All right. So this is the how-to. Lots of parents have questions on this. Some don't. If both of the parents are working outside of the home, and we have an older brother or sister that is helping with a lot of the household duties. This is really, really good stuff to go over with them. So a parent or an older sibling always needs to help the kids. So we want to make sure that we tell our families that we want the little kids to feel like big kids, and we want them to feel independent and like they can do it themselves. But we also want them to know always that a grown-up or an older brother or sister needs to check and make sure that they got all of the hard to reach places. So germs or plaque primarily like to live right around the gums. So I have a lot of parents tell me like, oh my gosh, I have a 1-year-old little boy and he will not open his mouth for anything, or he has bit me or something like that. So even if a child has completely clenched teeth, there are all of these areas of your teeth that are still visible and that you can still get to with a toothbrush without the child actually having to have their mouth open. So even if the child has their mouth completely closed, you can still do this. And if you, I always call it like fish hooking. If you fish hook their lips, you're out of the way of getting bit, even if the child kind of bites down on accident. But if they do bite their teeth together like that, it's okay, because the majority of those germs like to live around the gums, and that is where you're going to be able to reach. So you're totally fine. It is great to explain to the parents that if they push their child's lip up, like towards their nose, then they can have a clear line of sight of those areas that they need to be brushing well. If a child resists and doesn't want to brush their teeth, that's when you can start using fluoride toothpaste when the child is 6 months old. So that table says that table with the weird fluoride numbers that nobody gets, says that fluoride at 6 months old is appropriate, and that's when, if you ever did get fluoride drops or something like that from your dentist, 6 months is the age in which those could start. So if a child resists, you know, obviously making it kind of fun, brushing during bath time might be a great thing to do, or letting the child brush the parent's teeth or brush a sibling's teeth or something like that. Fluoride toothpaste, kids 6 months and up is okay, and it's totally fine if they swallow it. And we don't want anyone to rinse their mouths with water after they brush out their teeth. So this is something that they didn't even teach me in school. So if you guys think back to everything that I have talked about fluoride, fluoride's job is to help weak spots on our teeth be stronger. Our toothbrush is cleaning all of the crud off of our teeth. The toothpaste's job is to deliver a vitamin, which is the fluoride, to our teeth to help weak spots be stronger. If you brush your teeth and then rinse your mouth out with water, what did you just do? You just rinsed all of the toothpaste out. You just rinsed all of the vitamins out. You just rinsed all of the fluoride off of your teeth. So there's really nothing left on your teeth to help any weak spots be strong. The toothpaste does not clean your teeth. That's what your toothbrush does. And the toothpaste is delivering a very, very specific vitamin. That's why I've always loved Head Start and I've always loved OCDC, because you guys would have your kids, right, brush their teeth sitting down at the table and spit in the little cup. Is that right? And so they're not, you know, they're spitting any foamy toothpaste out, which is totally fine. But all of that residual toothpaste is still in their mouth, which is giving them the biggest benefit that you could give them. Toothpaste has more fluoride in it than mouth rinse. So if you're a mom or a dad, I can talk about flossing. Yes, absolutely. If you are a mom or a dad who is buying your kids Act mouth rinse, or you buy it for yourself, there's more fluoride in toothpaste than there is in mouth rinse. So if you're spitting and not rinsing, you're gonna get more benefit from your toothpaste than you would from the mouth rinse. But whoever invented all of these mouth rinses is freaking genius, because they're like millionaires now, and that's what this world has become. Really smart salespeople. So flossing is really important. for teeth that don't touch. So you will notice a lot of baby teeth have spaces in between them. If they have spaces in between them, usually the toothbrush can kind of fit in between those spaces and can adequately clean in between them. So flossing is designed to clean in between tight spaces. So if your teeth all touch together, your toothbrush obviously isn't, you know, reaching from front to back where your teeth touch. So that's why the floss is important. So most little kids, if their teeth are all spaced like they should be, which is not all kids, but sometimes more often than not, they have a lot of space in the front teeth, but then their back teeth touch. You would want to encourage that the parents brush. Floss those teeth. I also think that that is something that you should probably take a little bit of time to like get to know what the family's habits actually are. Because if I had a choice between them brushing their teeth with toothpaste twice a day or flossing their teeth, I would choose for them to brush their teeth with fluoride toothpaste. And so I don't ever want them to think that like flossing trumps brushing. But if they already have those really good like brushing habits established, like let's add one more thing to that. And then using those little floss things is totally fine. One other thing that I wanted to talk about in a demo, and we'll use little Elsa here, my daughter's little doll. So if you are, let's see, here, positioned the right way. If you are brushing a kid's teeth or an individual's teeth like face on like this, anytime that you touch a kid or do something like this, even to an adult, their natural reaction is to back up from you. And so unless you want to like pin them against the wall or the door, which would probably be fine, what I like to recommend that parents do, especially because kids are usually pretty short, is have the child, I'll put her up here kind of since this little doll is short, have the parent put the child on their lap or standing in between their legs or sitting on the edge of the bathtub or sitting on the side of the toilet or something like that, or even standing, and then have the child tilt their head and look up. So this will give the parent a really good opportunity to push the child's lip up, and then that child's head is going to be resting against the parent's body, and then the parent can use a natural brushing motion to brush the kids' teeth instead of doing like this. This is, I mean, like I'm a dental professional. Brushing someone's teeth like this way is very awkward for me, and like I really know what I'm doing. Brushing my kids' teeth this way is not effective at all. So even if I'm brushing their teeth in the bathtub, I have them turn around, I have them rest, you know, sit their back against the bathtub and then tilt their face up towards me and I'm above them. And then this is a natural brushing motion for the parent, like I said, because they're just moving it from here down. They can have their child look up at them. They can easily, you know, move this lip and push it up a little bit with their finger to make sure that they can get right at the gum line and do those nice little circles. And it gives you the best overhead light. So, and that seems to be really comfortable, especially with like little kids who are wiggly and that type of thing. You can kind of squeeze them with your legs, you know, and pin their arms down a little bit and that kind of thing. I'll have a lot of parents say to me sometimes that their child completely resists getting their teeth brushed. It is a screaming, kicking fight, and they are not going to do it. So the best analogy that I have been able to come up for families is walking across the street. If you were walking across a busy street with your 2-year-old and your 2-year-old was throwing a fit, because what do you do when you walk across the street with your kid? You hold their hand, you know, that's what most parents do with little tiny kids. And if that little kid was throwing a fit, and I usually ask it in the sense of like questions. So if you're crossing a busy street and your kid's throwing a fit, what are you going to do? And the parent's like, well, I'm going to grab their hand and make them, or I'm going to pick them up and I'm going to carry them. And I said, okay, that's perfect. That's exactly what I would do too. And why are you doing that though? Why aren't you just letting them walk across by themselves? Well, they could get hit by a car. Like, they're looking at me like, duh, you idiot. And so, but the whole fact is that I want them to be engaged in this conversation. I don't want to just be doing all the talking, because forcing your kid to hold your hand or picking them up, even if they're, you know, kicking and flailing and screaming and doing the whole like limp noodle thing, you know, where you're like dragging them across the grass. You're doing all those things as a parent because you know that if they crossed a busy street by themselves, you would be putting them in serious danger. If you as a parent are not, we'll just say, forcing your child to allow you to brush their teeth, you're putting your kid in serious danger of getting really, really bad cavities. So brushing teeth is just something that parents do. You could also use changing the diaper. Like, I can speak from experience too, that I mean, like, my son would do like this alligator death roll, and it was like a freaking knockdown drag out to put a flippin' diaper on this kid, and he would arch his back and he would roll and he would be like bright red crying because he did not want me to put his diaper on. Oh, but I freaking grabbed his leg, rolled him back, you know, like did whatever I needed to do to put his diaper on him. Not that that was keeping him safe or not, but it's, you know, he's obviously not potty trained, he needs a diaper. But I knew that I was just doing what I needed to do for my child. And even though I was having to use a little bit of force, I was not being inappropriate, and I was not like putting him in danger, and I was not like purposefully hurting him. So I have had to sit on my kids like in the hallway on their arms and like hold their forehead down, because nope, this is the rule. Like, mom brushes your teeth, and that's just what we do in this house. And it's usually always just a phase, just like the diaper thing is a phase, or not wanting to get dressed or whatever. So, so point being, parents have to help brush, or a sibling has to help brush. I don't care what the fit is, because the result of not doing it is going to be far worse than just doing it. So we will go to the next slide. I think we might be done. Yeah. Are there any questions that any of you guys have, or anything that I didn't touch on that you're curious about?
And you can either, you also have the floor to tell stories on maybe ways that you have been able to get a family to take a child to the dentist, maybe some strategies that you find have worked, or maybe you're struggling with a family and you have been for a couple years and maybe need some help with getting them into the dentist. This is your time. We have about 10 minutes to just finish up and talk about whatever you want in oral health.
Any books or songs? I think I make up stupid songs. Maybe I should publish them. I'm not really a singer. No, I have one book for my daughter that's a tooth book, but it really just kind of talks about like teeth in general. It does talk about cavities. It does talk about brushing, but it also talks about like all of the teeth that you have, their different names. I think that there are some YouTube videos that kind of go along with the potty training. I think that it's Elmo that talk about brushing your teeth. My daughter watches on YouTube. Has anyone ever heard of Baby John? No. Okay, well, I don't know where we found Baby John, but Baby John is on YouTube, and Baby John does all the things. He puts on sunscreen, and he eats his vegetables, and he, oh my gosh, this freaking little thing does everything. And so, but you guys should seriously do it. So you can seriously YouTube, just type in Baby John brushes his teeth, and you will find this cute little YouTube video, and they sing, and it's catchy. But yeah, Baby John does everything. I would really suggest him. And that's just something that I randomly like found on my own. Yes, my last name is Danielson. And just so you guys know, I am your guys' resource to any questions that you have that you don't know the answers to anytime during the year. So if you do need help with the family, or if there's like a weird thing, I am allowed to do home visits. I can do home visits. And so if you ever want me to accompany you to one of those or something like that, or if you just have a question in general, you're more than welcome to email me or call me. that's my job, and that's what I'm here to do. So I'm really passionate about oral health, if you couldn't tell. And I really like all this stuff. So.
And as you guys are doing, you might be able to do something for your home visitors, like a group social, and have Ashley come and talk about oral health, more than one parent, especially since we're doing virtual. It's easy for everybody to just jump on and do a presentation. So that's another option if you have a need and parents want to have a better understanding or have any desire for that.
Great idea. Perfect. Well, I'm glad I got to see most of you today. It's always more fun, I feel like, to talk when people are actually kind of like looking at you and nodding like, oh yeah, I kind of get what you're talking about. So yeah.
Actually, I wanted to say that it was fun to get this a second time. Now that you have been a parent longer, like experience some of the things that our parents experience.
Yes. It was definitely, my job is really interesting because when I first started, it was kind of like being thrown to the wolves, kind of like nobody knew. I didn't know. You guys didn't know because you've never really, I mean, you always had Dr. House, and that kind of thing, but my job and a little bit of my interaction is just a little bit different, than your typical dentist. So yes, I feel like I have learned a lot I feel like I've learned a lot about like cultural diversity and different families and different things through the families that I serve at WIC, which I know are a lot of your guys' families. And that's always really fun because obviously in my electronic health record where I keep all of the kids' information, if I'm at WIC, I pull up that same thing, I search for that kid and see if I've seen them. And a lot of kids, it's like, oh, I've seen your child at Head Start for the last 2 years. And now I'm finally meeting the mom and I'm seeing their brand new little baby for the first time. So it's always so fun to be able to say like, oh, I'm the person who saw Jessica. I'm the person who checks Jessica's teeth at school. And they're like, oh, and it's just like connecting the dots. And so that is really great. Ellie, one of those questions was, do you think that you're going to brush their teeth?
So we are not brushing their teeth in the classroom. Okay. No, just because with COVID specifically, since it's primarily, the word that's coming to my mind is distributed, but that's not the word that I'm looking for.
Like aerosols would be the word.
Yeah, so when they're spitting, we don't want to promote them spitting in the classroom, and so they spit in the cups. And so we're not going to be able to do that for a while, I don't think. Okay. So part of the reason that I brought Ashley here for pre-service was to help give you guys the tools to continue to educate families regarding oral health, because it's going to be I'm going to try and do a big push the first couple months of school and through the rest of the year about making sure that families know about all the benefits of oral health and how they can be doing it at home. And so when Ashley comes out to our Oregon sites and when Dr. House comes out to our Washington sites, I put together little dental like totes, and they're going to take home bags with floss and toothpaste and toothbrushes so they can still do it at home. So we are still going to be promoting it and trying to work with families, but we're not going to be able to toothbrush in the classrooms this year. Well, at least for the first half of the year. Until further.
I'm so curious, like if they come out with a vaccine, if like all of the COVID craziness is just going to end.
Yeah, it's going to be pretty
but I'm just curious. Like we've never lived through a pandemic before, so we're all learning. So you guys are saying that the kids never spit, but I think what Ellie's saying, and just like and not that you guys necessarily deal specifically like with the Oregon Department of Education, but just like a lot of the stuff that the Oregon Health Authority has released on that, like it comes down to like preschool. Like there are a lot of preschools that are not even allowing kids to have backpacks or folders. Nothing comes into the school, nothing goes out of the school besides the kid, which is interesting to me because it's like, what is my kid gonna have on it that the backpack's not, type thing. But it's just a rule. So because COVID can be spread with droplets and that kind of thing. Not that I support it by any means, but I understand why they are eliminating toothbrushing. And the best we can do is just help support our families in the best way possible. I am still going to supply you guys with toothbrushes and toothpaste that can go out to all of your kids. We can do that 2 times during the year. And I mean, because this is a little bit of a different time and I'm not as busy with school, I'm not busy with schools, you know, I can really come to Head Start, Ellie, just so you know, I can really come to Head Start as much as you guys want me to. So I can come up to 4 times just to provide treatment in a calendar year. How our agreement has always read is that it's a minimum of 2 and a maximum of 4. So a lot of times it's been twice during the year, just because we have so many other schools and so many other entities that, you know, we have to, you know, just kind of schedule everybody the best that we can. But I have lots of educational things like puppets and big teeth with toothbrushes. I mean, if you guys feel like it would be beneficial for your classroom, we can schedule times. You can work through Ellie. If Ellie gives you the permission, you can work with me directly, get a couple of teachers together where I could, like, you know, bounce to the different classrooms and do like a 15-minute, you know, hands-on thing with the kids to, you know, help get them motivated and stuff like that. And then, you know, maybe after that is when we could, you know, be providing some more support and information to the families, because maybe the kids will be talking about it at home, you know, I don't know. So, but just so you guys know, those are options.
Mm-hmm. So yeah.
Yes, so
also,
you guys are saying all the right things on this little typing thing. So.
Yeah, and like we're also planning on sending home toothbrushing education flyers with the toothbrushing kits, so the parents have some additional information that goes along with that.
Perfect. Cool.
All right. Any other questions? Yeah, cavity free. So Belina, unfortunately, Ashley does not come to Washington. And I'm not sure if...
But I wonder if there's a workaround for me just to be able to do education.
Yeah, maybe if you're not practicing, that might be an option, but she can't come and do screenings out there.
Yeah, I can't touch them.
Yeah.
I can't log any information on them, but I will send an email. I'll write a note to myself right now. I'll send an email to my manager and I will ask, because this whole Washington thing was a pretty big discussion on our end last year, like what we were going to do for Mid-Columbia Children's Council. And, but we never spoke specifically about education. And so I would almost imagine, since you guys do spread from Oregon to Washington, if it's just education, I could peg it off on being like, it's not fair to the Washington kids that they don't have access to the same education as the Oregon kids. So I'll say something like that.
And I also want to just add that I know we are limiting additional people in our classrooms right now. So it might be a better idea to start with maybe going to parent meetings that are going to be held virtually. And that way the information is going directly to the parents, because we really are trying to avoid any additional people in the classroom. But we are going to allow for her to come and do the dental screening itself. I don't know if that would be, at this point, we probably won't have her come into a classroom to do education for the kids, but we can do something with parent meetings, I think. Okay, well, if there's no further questions, I think we are done. We are actually right at 2:45, and which is like perfect timing. I can't believe it. So I hope everyone has a great rest of your day.